Hello my friends. Why is my dog having trouble peeing? Painful or difficult urination is indicated with the medical term of dysuria. A painful urination is normally accompanied by other symptoms such as hesitancy or straining prior to, during, or after urination. Is urinary retention in dogs serious? Imagine what would happen to your body if you could not pee. Aside from the discomfort, there is the matter of waste elimination to consider. The bladder removes toxins from the body and plays an important role in how your body functions. And a complete obstruction will lead to the dog's death within 3 to 5 days. The most common cause of dysuria in dogs is bacterial cystitis. A number of diseases and conditions can cause the inflammation that is called cystitis. The most common cause of cystitis in dogs is an infection caused by bacteria. Other common causes include bladder stones, tumors, or polyps in the bladder, and abnormal anatomy, especially in female dogs. Some dogs will experience interstitial or sterile cystitis, a condition that causes inflammation and associated clinical signs without any infection. You may have heard of this type of inflammatory cystitis in people. What are the clinical signs of cystitis? The most common clinical sign is hematuria or blood in the urine. Cystitis causes discomfort and pain. Dogs with cystitis may spend several minutes squatting and straining. Straining is called dysuria, to produce only a small amount of urine. And they may urinate more frequently than normal, called polyuria. Many pet owners report observing their pet squatting frequently and dribbling little spots of urine in multiple locations. Other causes of dysuria include presence of stones or crystals, tumors, conditions affecting the reflex of urination, anatomical abnormalities, obstruction caused by other structures compressing the urinary tract, and a minority of other uncommon causes. What you can do: watch your dog closely to see whether or not he or she is peeing and how much. Feed your dog canned food, which has more water in it, or add chicken broth to your dog's food. Encourage your dog to drink more water. You can do this by using water fountains and providing additional bowls of fresh water throughout the house. Signs that your dog needs to see a veterinarian: frequent attempts to pee, which often produces little or no pee, blood-tinged pee, crying out in pain, or other signs of discomfort when attempting to pee, becoming progressively more lethargic, excessive licking of the genital area. If your pet shows difficulty or pain when urinating, he should be examined by a vet ASAP to establish possible causes and set up a diagnostic and treatment plan. Recovery of inability to urinate in dogs. The length of time for recovery and the amount of home or clinic management will be contingent on the cause of the problem. Many dogs regain normal urination, but some may require a catheter that remains inside the body for days to weeks in order to maintain urine flow and healthy bladder size. In time, the bladder may recover the ability to function normally. If your dog has a spinal cord injury or nerve damage, the veterinarian will teach you how to manually empty the bladder. Regular clinical visits will be necessary in order for the veterinarian to verify the continued health of your dog. Urinalysis on a frequent basis, as well as antibiotic therapy, may be needed for some time. A healthy diet and sufficient exercise are also important. Recurrence is possible, so take your dog to the veterinarian without delay if you suspect a relapse or a potential infection. I really hope you enjoy this video. Subscribe and turn on notifications so you'll be the first to know when a new video arrives. Thanks for watching and we'll see you next time.